My name is Domingo Jimenez. I will presentation about the adult and gerontological clinical nurse specialist competition competencies competencies and subject adult and aging under by Dr. Maria Julieta Simbayan. The adult and gerontological clinical nurse specialist competencies are a set of skill and knowledge areas that are essential for nurses practicing in the adult and gerontological population. The competencies were developed by the National Association of Clinical Nurse Specialists (NACNS) are used to guide CNS education, practice, and certification. These are competition cover 8 key areas. Let's see. The first is direct patient care. The ability to provide expert evidence-based care to patients and their families across a variety of settings from primary care to acute and critical care. The second is when we're done with the direct to patient, it will go to consultation. The second is consultation. The consultation, the ability to provide expert advice and guidance to other healthcare professionals, including nurses, physicians, and administrators. The third is systems leaders. The ability to design, implement, and evaluate healthcare systems and programs that improve patient outcomes and quality of care. So when we done with the direct patient, the client, and then we go to consultation, the third is we need to make it manage it, or we can it can say the system of leadership. So how to design, implement the one that we did, to evaluate or implement healthcare system, so that when what is the result, and the result is can be quality of care. The fourth is collaboration. Collaboration is the ability to work effectively as part of a healthcare team with the aim to improve patient care outcomes. So in this case, we need to collaboration. So we will work together to make healthcare team to providing the good things that it will to improving patient care and outcomes. And 5 is coaching. Coaching is the ability to mentor and coach other nurses, helping them to develop their skill and knowledge. Yeah. So in our inside of it, also have the course how to help in to develop the skill of take care, health care. So uh, it will add more knowledge or develop or expand knowledge how to take care of the patient. So it will bring that good outcomes for the patient or client. And the sixth is research. The ability to critical and evaluate research finding and apply evidence-based practice to improve patient care. So even though we already evaluate everything, but we need to have the more information through the researching, so that we can it can help to nurses to have critical thinking, evaluate through the research finding, so that it will, when we make implementation intervention, it based of evidence that to prove the practice the to patient health care in the right way. And the seventh, clinical and professional practice evaluation. The ability to continually evaluate one's own clinical and professional practice in order to identify areas for the improvement, ensure that best practice are being followed. So when nurses already researching, it need to uh, practice and clinical and professional practice evaluation. So there's have evaluation so that to identify which part or which area need to improve to ensure the best practice are we follow are there to following to implementation to health care for to the patient. And eight is talking about ethics. The ability to understand and apply ethical principles in clinical decision making and to advocate for patient rights and preference. So, we're talking about ethics. We will talking about the decision. So what will we want to apply, or we want to implement that things that to help their health? We need to ask their agreement, and so the treatment, it will based on the what they agreement for. So it will so it can help them uh, to get a good healing while we will taking care of them. So they also understand that which one is their part, and it will help them to help them, or in nursing side, to advocate patient that what we did or what we gonna do, it will on the trend or on the based on the what we agree with, and then what is in the right way. For adults and gerontological clinical nurse specialist, the NA and ANA has also defined a specific competency relative to the healthcare of adult and older adult person. This is competencies where we're talking about that. This is the competency. Their competency reflect that unique skill and knowledge required for clinical nurse specialists who specialize in care for adult and older adult patients. They provide a framework for the development of education program and evaluating of evaluation of the clinical competence for the adult and gerontological clinical nurse. That's all about my presentation. Thank you for your participation, and this is the references that I got, and then I make for this presentation. Thank you.